Imagine drowning, and instead of throwing you a lifeline, somebody tells you to go and pray harder. It might be an imagination, but it's a reality in Nigeria. Good evening, ladies and gentlemen. My name is Susan Ogolekwu. I'm an administrator and also a student of Further's School of Business and Communication. My topic today is breaking mental health stigma in Nigeria. According to the World Health Organization, it is defined as a state in which individuals are able to realize their abilities, cope with normal stresses of life, work productively, and contribute meaningfully to their communities. What is the burden of mental health in Nigeria? In Nigeria today, we have very few mental health workers. A lot of doctors and nurses are not thriving in this profession in Nigeria because people shy away of reporting cases of mental health sickness in Nigeria. For us to thrive in Nigeria and be able to communicate and understand and also give help to those suffering with mental health, we need to understand the mental health stigma, which is a negative attitude and belief towards everybody who is living with a form of mental health or the other. There is also cultural barriers as to mental health. A lot of places today, mental health is considered spiritual. You go to some homes, people are being tied up in rooms, flogged, beaten, pouring holy water, calling priests, pastors to come and pray for them instead of seeking medical help. Some families even shy away from introducing these children into society just because of the stigma. Nobody wants to be seen or heard that I have a mad person in my family. The consequences of stigma leads to depression. A lot of people, we all seated in this room, if we like it or not, according to the research done by WHO in 2022, 10% of Nigerians, 1 in every 10 Nigerians is living with a condition of mental health. The UNICEF study also attributes that to the cases of mental health in Nigeria, but we shy away from it. Our government shy away from it. The socio-economic impact of mental health is that it creates unemployment. Because look at the Gen Zs we always talk about today. According to study done by the the Federal Ministry of Health in 2022 under the National Mental Health Policy, it states that a lot of younger people today are unemployed because of mental health, and the condition is also affecting the economic of the society. The barriers of mental health. Across the mental health case in Nigeria, we need to be able to gather more professionals that will go into this field, study it, and be able to relate with those people living with the condition. We need more education in our schools, in our public places, in our places of work. We need to show more empathy towards these people living with one form of mental health or the other. The strategy, like I mentioned earlier, is education, communication, and more awareness, public awareness. Let us not shy away from it. Let's be able to educate people, talk to people, be informed on how to manage people living with one form of mental health or the other. Again, the role of the society as individuals, as business owners, as parents, as public speakers. Let us talk more about this, which is eating into the fabric of our society. Let us be more aware and able to inform people about it. Mental health is not a cultural barrier. It's not a thing to be shy about. Mental health affects each and every one of us in one way or the other. Let us be more empathetic. Let us learn to give listening ear to someone when they want to talk to us. Because the more we are silent about it, the more this condition will continue. And if this condition continues, without us being granting them listening ear, the stigma continues and we cannot conserve lives. My name is Susan Ogolekwu. Thank you very much.